Narcotic pain medications like Tylenol number 3, vicodin, norco, percocet, all of those, they all fall under Schedule 2 of medications. And the role of narcotics, at least for dental pain, is secondary to pain control. These narcotics do not effectively take the dental pain away, but it makes the person not to care about having the pain. If you evaluate, and people have evaluated the analgesic effect of, say, a tablet of vicodin or 5-10 milligram of hydrocodone, which is the active ingredient in the vicodin, to 1,000 milligram of acetaminophen, the acetaminophen does more as an analgesic than the vicodin. But whatever is left of that pain control of acetaminophen, you very much will feel and bothers you. But the good thing about the vicodin is that even though you continue to have some of that pain, you won't care. And that's why it's called euphoric action, and that's why it's a narcotic, and that's why it's habit forming, because your brain continuously seeks that. Nowadays we are dealing with a very, very high epidemic of narcotic addiction in America, especially in Midwest states. They have found that most of these addicts have been introduced to the narcotic pain medications following a dental visit, usually a wisdom tooth extraction. So you see this innocent 17, 18-year-old goes to the dentist to take out wisdom teeth, and dentist, out of kindness of his heart and out of following what he thinks is right, will prescribe vicodin, norco, or percocet to this patient for them to be comfortable during recovery. Sure, they will be comfortable, but now you have introduced a drug to this person who previously this person was not familiar with. And the rest of it is, it's public knowledge how the next time around they seek it out, and that one thing leads to the other, and therefore we have all these heroin addictions and overdoses that we see in the news every day. Therefore, it is my opinion, my policy, and I recommend my other colleagues for us to reduce and try to eliminate the prescription of narcotic pain medication to younger people. So if I'm doing an implant for a 22-year-old, or if I'm doing wisdom teeth, I give them the prescription for the Motrin and Tylenol, and I'll tell their parents they'll still be complaining, they'll still have some pain, but let it be. It's better for them. I don't want to introduce them to narcotics.
Now, what about for the older individuals?
Yeah, so yesterday I was doing this implant surgery for a 60-year-old person that I've done other implant surgeries for her before, and she asked for Percocet. I didn't hesitate. I mean, this person, if she was going to be addicted to pain medication, she was addicted 20 years ago, 30 years ago. She is not, and one prescription that I give to a patient is not going to make anyone addicted. This is most important for the people who have not been introduced to it, and younger people who have this curious mind as to find out what it is and try more of it, to experiment more. But as you said, an older person who's had exposure to it before and it's fine, and it's it does not have that addictive mentality, that's perfectly okay. You can use it, but use it sparingly.